The day-to-day stress on Americans is huge right now, but imagine what it's like for healthcare workers on the front lines, people whose job it is to care for the sick. KCTV5's Amy Anderson checked with local hospitals to see what's being done right now to take care of the people who take care of us, and she's live at Menorah with what she found out. Amy.
Well, hi, Ellen. Imagine getting home from work and having to put all your clothes into a garbage bag in the garage and then go inside and take a shower before you can ever say hello to your family. That is exactly what is happening around the world tonight and right here in the metro. A little reminder greeted doctors and nurses as they arrived on the job at Menorah Medical Center this week. Dr. Stephanie Graff says both the hospital and all of her colleagues are watching out for each other. They are keenly aware of the potential the coronavirus has to affect their own lives.
Every interaction ends with, but how are you doing? That sort of weighted question to make sure that everybody's still coping.
It's not easy. Doctors and nurses on the front lines of the pandemic are exposed to so much. The sickest of the sick. So many stories that don't always have happy endings. And while they may be used to some of that, what's not normal is that at the end of the day, they could bring that virus home to their own families. Tom Patrizio is the CEO of Tri-County Health Mental Services. He says healthcare workers are vulnerable to experiencing emotional trauma through all of this.
They're also having to maybe make decisions about, we're going to see this person first and this person needs to wait. And those are very hard decisions. They're very stressful.
The hospitals we talked to offer an employee assistance program. Dr. Graff even says at HCA hospitals, that phone number is on most of the COVID correspondence they get just in case. Patrizio recommends healthcare workers practice lots of self-care whenever they can, whether it's taking a walk, watching a movie, or catching up with an old friend. And find someone to talk to that you trust.
Because one thing we know in our behavioral health business is you don't want to hold that inside. You want to get that out and talk to somebody about it. It does relieve your own personal stress when you do that. And if you hold it inside, it only exacerbates the situation.
Now, Dr. Graff reiterated that doctors and nurses knew what they were getting into when they joined this honorable profession, but she does say it is an honor to care for people who are sick. Reporting live tonight in Overland Park, Kansas, Amy Anderson, KCTV5 News.
Yeah, so many of us know a nurse or a doctor right now that is involved in this fight, and we sure appreciate what they're doing right now. Amy, thank you.